It is one of the biggest community events in the Garden City and is coming up Saturday, October 20th. That's the day of the Miracle Mile Walk in Augusta. As you can see from last year's event, downtown will be a sea of pink as thousands of people gather in the Common between Reynolds and Broad Streets. 15,000 people walked last year, raising about $300,000. The Miracle Mile Walk supports University Hospital's Breast Health Center and the Mobile Mammography Unit. And joining me today with specifics of all of this is Laurie Ott, the president of University Healthcare Foundation. And Laurie, we're getting close now to the 2-decade mark.
We really are. We are very excited. This is the 18th annual Miracle Mile Walk,
wow.
And it's a historic year for our hospital because the hospital turned 200 this year, and the Miracle Mile Walk is part of that 18-year history. So we are really excited about this Miracle Mile Walk. And Jenny, you were there from the very beginning.
From the beginning.
It's so exciting to be here talking to you about something where all the dollars we raise stay right here in our community, they stay right here in our region, and they save local lives. And I'm excited that we get so much support from the community.
I think that is such an important thing. You can't say it enough when you're talking about the Miracle Mile Walk. The money raised stays locally, and it helps patients here. It helps support systems. And one of the things that you know about our university hospital is that we have the Breast Health Center, and it has a new name. And show us the poster, Laurie.
Well, we are excited because we have dedicated our Breast Health Center. It is now the Randy W. Cooper, MD Center for Breast Health Services. So that is Dr. Cooper.
There's Dr. Cooper.
And we are really excited that there he is. He's got sunshine. There really is a little bit of light on him. He is a superstar. he is the center of the sun, center of our universe when it comes to breast health. And really, we have so many talented physicians, Dr. Ye, Dr. Pouliers, and so many others who are dedicated to saving lives from breast cancer, but attacking it early. And I was really fortunate a couple of weeks ago to be part of our accreditation process. We bring in the American College of Surgeons. We are the only accredited breast health center in our region. And we were the first, and we are now the only. What's really exciting about that is that a woman gets comprehensive care from diagnosis to treatment to support. And it's unique in our region, but it also means that I, as a woman, I can feel very confident when I come to University Hospital for my mammogram that I'm going to be taken care of, regardless of what the diagnosis is.
Yes.
7 out of 8 women will hear that they don't have breast cancer, that they have a good screening. That 1 in 8 is who we're really talking about in terms of the Miracle Mile Walk. We want to make sure no woman is ever turned away from getting those early screenings, the diagnostics. And we know if it's detected early, breast cancer is very treatable, and a woman's chances of survival go up exponentially. Yes.
So one of the things that's really important too, the Mobile Mammography Unit, you've heard so much about it, you saw a little video there. It takes the mammogram to people who might not otherwise get it.
Right. And you know, I got a letter from a grateful patient, and she's a local librarian. She lives not in Richmond County, Columbia County, Aiken County. She lives in one of the outlying counties, and she said, I was too busy to make time to get my mammogram. So now she said in her letter to me, so God brought the mobile mammography unit to me.
Yeah.
And I stepped on and I found out I had breast cancer, and I am alive today because it was caught early.
Well, let's talk a little bit about how you can help other people. You see these great shirts here, the Miracle Mile shirt. We have a full screen to show you with the date about it. You want to circle this date on your calendar. It is October the 20th.
We always do a fun little warm-up from the Family Y. The walk gets started at 9 a.m. It's Saturday, October 20th, Augusta Common. So James Brown is looking over the Augusta Common, and somebody always puts a pink bow on James Brown somehow. I don't feel like he would mind. I don't feel like a pink cape, occasionally a pink boa, and we're just so thankful to have the support from the community and the teams that come out. And the ones that really move me, Jenny, are those, you know, I walk in honor of Meemaw, and there's a start date and an end date, which means that she lived her life and lost her battle to breast cancer. We want to create more survivors in our community. We want to give women a fighting chance against breast cancer, and this is the community's chance to be on the Miracle Mile Walk team, to help us, to donate, to form a team, to sponsor.
It really is the place to be, isn't it?
It's
on
a
that
lot of
Saturday
fun.
morning in Augusta. It is fantastic.
Survivors appreciate being lifted up and celebrated.
Well, that's the place to do it for sure. Laurie Ott, always good to see you.
Thank you, Jenny.
Coming up next on Jennie, meet a man whose mission is spreading awareness and raising funds for men's breast cancer. Cecil Heron's story will have you talking to your husbands, sons, and brothers about the warning signs for men.